Who wants to start?
She's gonna start.
Okay. All right.
So
it's already started.
He already asked a question. So what's your answer?
What up, guys? Listen. Today the question is gonna be, is it possible to be overweight and healthy? All right. Comment, like, subscribe, follow the channel, support the channel. Appreciate y'all. All right. Go ahead. So tell me your names real quick.
I'm Aiden.
I'm Matthew.
All right, so the question is, like, what are your thoughts on the fat acceptance movement? Like, what is is it okay to be overweight and healthy? Is it possible to be overweight and healthy? That's the question.
I guess for me personally, if you're going off of the BMI scale,
Yeah.
Personally, I don't believe the BMI scale is completely accurate as far as weighing fat and muscle on somebody. I think technically it is possible to be overweight and healthy.
Yeah.
Just in the way that, I mean, I know several people who are technically overweight according to the United States BMI scale.
Yeah.
But they go to the gym, they run, they're perfectly healthy in that sense, they eat healthy.
Yeah.
But they just gain weight differently than others do. They have a different metabolism.
Yeah, I get that. All right, so what do you think about it?
Yeah, I think the same thing about it. It's like you can be like overweight in a sense. You could have more muscle and still be healthy, and just like the same thing, you can be like in a healthy body weight, but you can still be very unhealthy. You can still live a very unhealthy life, you know, like eat donuts all the time and stuff and just not gain weight.
Yeah.
Some people just have different metabolisms.
I've seen bodybuilders with who are classified as overweight.
Yeah, and they're still healthy.
Yeah, and they're still healthy.
Yeah.
So I've seen both sides, definitely. Yeah. And then what about the online movement of let's say your BMI is high and you're not a athlete, right? Can you be healthy that way, or is there an underlying issue there? Like, is that?
I would say you can be healthy still if you're over like a certain BMI still, like because like I said, some people do gain weight differently. You know, like people have different metabolisms. Like I can have a super good metabolism but live an unhealthy life.
Yeah.
And my friend who lives the exact same life as I do, eats the same exact food as I do, weighs 50 pounds more because he just gains weight differently.
Oh, okay. All right. I appreciate y'all. All
Yeah.
right. So what are your thoughts? Is it possible to be overweight and healthy?
So my first reaction is no.
Yeah.
But I think it's on a spectrum. I think that there's levels to health, right?
Yeah.
For example, I'm a pro athlete. I'm an MMA fighter.
Yeah.
So my sport is based around weight, like managing your weight, cutting weight, losing weight, gaining weight. So I focus on weight and I have to be at my best.
Yeah.
Whereas for an average person, they don't. And so there's a little more, I guess, maybe slack in their daily life because they don't have to be at their tip-top shape all the time.
Okay.
But I think an excess of anything is unhealthy, so an excess of fat is also unhealthy.
Yeah.
But I think that goes around for everything. I think a good balance.
Does your height factor into it too, or does it?
Right. And that's the thing. Like height, like you can't look at one person and say, okay, like they're this weight and that's worked for them. Like technically, I'm overweight. Like I should be around 135, and that's my fighting weight. But I walk around at 150.
Yeah.
And that's just, so technically I'm overweight.
Yeah.
But I'm pretty healthy.
Yeah.
And
then does a good diet matter? Like, does a good diet matter?
That matters the most, I would say. I think for sure, like, going on walks, adding to your like physical training or whatever.
Yeah.
But your diet ultimately fuels that.
Yeah.
And if your motivation to do that is based on your diet. So
yeah.
If you have a bad diet, you're probably gonna have a shitty performance at whatever you do. So,
And you said you fight in what?
I'm an MMA fighter.
MMA fighter? Okay,
Yeah.
Okay, that's dope, man. Hey, congratulations, because a lot of people do not want to do that.
Oh yeah, no problem. No problem. Thank you, brother.
Hey, appreciate you.
Yeah, no problem.
Okay, so is it possible to be overweight, fat, or healthy, and healthy?
Yes, because I think that being healthy has nothing to do with your weight. I think weight is genetic at some point.
Yeah.
So I do think that there's people that are just genetically like just bigger.
Yeah.
But it's not to say that they're not healthy. I've met some of the skinniest people that are the most unhealthiest people I've ever met.
Yeah.
So.
Yeah. And then does the diet matter? Like, does their diet from a young age matter?
I think yes.
Yeah.
If certain things run in your family, if you're like diabetic or certain things just run like high blood pressure and stuff. But personally, I just feel like eat whatever you want to eat.
Yeah. I appreciate you for answering that question. Let me ask you one more thing.
Yes.
Do you have family that has certain diabetic conditions?
I have family that has like high blood pressure. I'm drawn to sodium. I love like chips and like all that stuff.
Yeah.
And then I have family that's like big, like runs like high blood pressure runs in my family.
Yeah.
I'm not much of a sweet person, but I do like sodium.
Oh, okay. So like, and how's their life going right now? Is it better? Are they
they're still living.
Yeah, they're still living.
They're still living. They eat whatever the fuck they want.
Oh, okay.
I mean, fuck it, we're all gonna die someday. So
yeah.
So
I know. I'm a nurse.
Eat what you want, live how you want to live.
Yeah.
And I think as long as you like work out and you try to incorporate some sort of like exercise in your life, I think you'll be good.
Okay. Thank you so much for coming on. Yeah.
Weed is good.
The question is it possible to be overweight and healthy? And why? And why not?
Damn, that's like me.
Yeah, right.
I feel as though I feel like that's me. Like, I'm not even gonna lie, but me being in healthcare, like, no, you cannot be overweight and healthy. Like, if you're overweight, if you eat healthy and you work out, exercise once or twice, throughout the day, like, that helps. People don't understand. I feel like, majority of the things, as they say, is like it's 70% what you eat and 30% what you do, like as far as exercise.
Yeah.
So
wait, pause. Let's hold up. Because a skinny person could be considered healthy on the chart, but they're not exercising or eating healthy. Because of genetics.
Can we talk about the West?
So
wait.
I, as a person, I work out 3 days a week.
Yeah.
I'm on the Stairmasters 20 minutes, sweating my ass off.
Yeah.
I'm not seeing the results like a skinny person.
Skinny people can be unhealthy as well.
unhealthy too.
Yes, skinny people can be unhealthy as well. But being overweight, like some people are overweight because their thyroids, or some people are overweight because due to other health conditions. But being overweight is not good for you. I'm sorry. It's you have to think about like the amount of stress you put on your heart just to breathe, just to take an oxygen. Your OT stat is sometimes lower, sometimes it's higher.
Yeah.
You have higher chance for diabetes. You have a higher chance for high blood pressure, like
high cholesterol.
High cholesterol. Like you have all these different other factors that go into play when you are obese. So I really do believe.
What do you tell your patients and when they come in with bad news?
I have a patient that is over 300 pounds. I have a patient that's over 400 pounds.
That's totally different.
It is considered their patient right to, if they want to indulge on eating and they know that their health can be affected by it, they still do it because that is their peace, that's their comfort, that's what they feel comfortable doing. Yeah. Even though it's killing them. Mm-hmm. It could be killing them and they know that it's killing them, but they still don't care. Yeah. So yes, being obese is not okay. Health is wealth. Let people know that. Health is your wealth, literally.
Yeah.
Literally. That is true. But however, as a person like me, I am considered obese. Yeah. Because of my height.
Because of
and also because of the chart that the general chart because that they have for everybody. So as a black person,
hold on. Go ahead.
I have the hips, I have the thighs.
Yeah.
They're not going nowhere.
Yeah.
Zoom in
so am I considered overweight because I have the hips and thighs, or am I just considered overweight just in general because I have it?
Well, the thing is, like,
because you also have to take in
some people call it curves, right?
Yeah, some people call it curves. Yeah. But the doctor is going to be like, I'm overweight. Yeah. My doctor's, for sure, my doctor said I'm overweight. Yeah. Because I'm not meeting their standard. Yeah. So just because I'm not meeting their standard, is it considered
what was the
overweight?
question? Can you be overweight and healthy?
No, but let's generalize But let's generalize. To what standards? Yeah. To the hospital? Because every white person is not going to consider overweight. Yeah. So we have to consider genetics at the end of the day. Before we be like, oh, are you obese or just overweight? Yeah. Because that's a big difference.
What?
Because I'm not saying I'm 500 pounds and not doing shit.
People genetically that have been the most unhealthiest. And then some of the most overweight people that have been so healthy.
Yeah.
Okay, go ahead.
We're led into that question, right?
Uh-huh.
How important is your diet then?
How important my diet? I'm gonna, at the end of the day, I'm gonna eat whatever I want to eat.
Okay.
Because I'm gonna work out. Okay. I'm gonna exercise. So I'm gonna walk and all that.
Let me tell you.
I'm not gonna strict myself and be like, oh, just salad and vegetables and all that stuff. Because I'm trying to meet somebody else's standard.
Yeah.
If I could fit my pants in the size I truly desire, I'm healthy.
What size do you truly desire?
I'm not saying the size. Guys, nobody's business but mine.
But that is true. I feel like African Americans or other cultures, I don't want to just say other cultures, but we do have a higher BMI than other people. Like our BMIs are different. They're always going to be a little bit higher or a little bit because we're a little bit curvy. I remember when I was young, they told me I couldn't do gymnastics because of the way of my body type. I would always lose points just because of me being on the bean and being out of stance. So it's like, I do get what she's saying. Like, it does take parts in like your genetics and things like that. But being overweight and like you said, to whose standard? If you're going off of your standard, then what is obese to you? What is healthy to you? Yeah. And I don't know. I just feel like your nutrition is everything. Like they literally say 70% what you eat is how you're going to feel. Yeah. It's going to play into your energy. It's going to play into how your stamina, getting up every day and lasting throughout the day. Like
that's about 4 to 5 days a week.
Okay. Yeah. So I don't eat breakfast.
All they say is literally breakfast. And what people don't understand, they say, oh, you're supposed to eat 3 meals a day and 2 snacks. No, you're supposed to eat 6 to 8 times a day. Yeah. Literally 6 to 8 times a day, and they're supposed to be small proportions. Yeah. And they're supposed to be healthy proportions. Yeah. I learned this when I was in college. I played at the collegiate level. Yeah. So that's what they taught me. You're supposed to be eating 6 to 8 times, but small proportions. Yeah. Fruits, nuts, trail nuts. Things that are going to help replenish the energy in your body naturally. They tell you when they go to the grocery store, always shop on the outsides of the grocery store because everything on the outside is healthy. Literally, if you think about it, everything on the outside of the grocery store is healthy foods. Yeah. Once you start going in the inside, that's when you start getting all the junk.
Yeah, that's true.
So 70% nutrition, 30% working out. Literally, what's 30%? Yeah. Waking up, walking out. Even though I don't do it, and I'm guilty of it.
Yeah.
For work.
I walk every day.
I thank you for answering these questions.
That's not doing nothing.
And you know what? You got this. Don't give up.
Oh, boy, I'm getting to my drink side.
Yeah. All right. So the question is it possible to be overweight and healthy? Like, what are your thoughts on that and also the fat acceptance movement?
One, I don't think I'm a medical professional, so I wouldn't be as versed on it as I would like to be. Yeah. I also think depending on how you are as an individual, whether you're conceptualized as to be skinny or you have what's called nowadays like pretty privilege, I believe. Yeah. I think it's a much more complicated issue. Yeah. I don't necessarily know if people who are overweight or qualified as obese are particularly unhealthy, but I do know that if you go to a medical professional, they can probably tell you or give you a good answer. And I think that more people should go to their medical professional or have the right to go to them for actual professional,
to find
diagnosis in order for them to have a basic understanding, because maybe you were born with something that isn't conceptualized to be skinny, but it's much more complicated than that.
Okay, all right. And like how important is someone's diet in their daily life?
Unfortunately, I think in the United States, particularly, consumerism is an issue, especially what we have access to, and whether that's a good or bad thing is going to be subjective. But dieting in general, I think even the word in itself can be poked at. Yeah. I genuinely believe that there is a consumerist issue here in the U.S., and what we decide to overconsume is going to vary per person, per socioeconomic circumstance for every individual, especially depending on the group that they're in or ethnicity that they have. So it really does vary, unfortunately. Unfortunately, I don't think I can give a straight yes or no answer.
Okay. Thank you so much for talking to me. And hopefully you have a good day today, all right?
Thank you. You too.
All right.
Here you go.